Hi everyone, I'd like to introduce myself. I'm Helen Slater. I'm a clinical researcher and physiotherapist based at Curtin University in Perth, Australia. And I'd like to thank the ISP for the opportunity to share with you some of the work we've been doing around partnering with people with lived experience to improve integrative pain care. So there's two programs of work I'd like to briefly share with you, and I think these highlight well the two sides of the coin that we need to focus on, both the lived experience and also then how we build health workforce capacity to support better integrated care. So I'd like to go to the first program of work we've undertaken with young people and listen to their voices, which really highlights well the area of need for better integrated care for young people 16 to 24. We know that's a problem area, particularly in Australia, where young people can't access the care they need. It might be fragmented, unaffordable, and certainly not always and often not well integrated.
What you're feeling with pain impacts every single aspect of your life. Like, it impacts your mood, it impacts how you interact with people, it impacts your study, it impacts your exercise, it impacts everything.
The young person being constantly told, no, it's not this, no, it's not this, it becomes disheartening. It becomes a case of, well, does anyone actually know what I'm going through? Does anyone actually have any answers that they can help me with? Is anyone actually going to support me?
Having other people to chat with who are going through what you are experiencing is completely invaluable. The feeling of validation, of understanding, of having someone who's gone through what you may be going through now and they're further down the journey.
If we can move more to a listen first and empathize and take the judgment away from it, I think that's when you can get proper collaboration, and that's what we want.
So that short clip highlights a number of areas that have traditionally been considered things you learn along the way, but in particular that active listening, the validation, the reassurance, the non-judgmental approaches to help better support integrative care across the disciplines is really, really fundamental. In addition, of course, to the impact on all the various parts of people's lives that need to be addressed as part of a broader plan. But to do that well, we need a shared understanding. So partnering with people with lived experience is really critical to help shaping health services in that way. And so Young Pain Health helped us co-create digital resources with young people to support better integrated care there. The other side of the coin then is moving to how we train our health workforce. And the second clip I want to share with you is around a program of work where we've focused on, again, partnering with people with lived experience, carers and clinicians, to try and understand how we can better shape our training curricula to ensure better integrated care. And I'll share that with you now.
This bit of work is part of a 4-year broader program of work that's funded by the Commonwealth, and it aligns with their National Strategic Action Plan for Pain Management. And one of those 8 goals was upskilling the health workforce across discipline to support better quality pain care. So in training our health workforce, often that's done by discipline. It's really up to individual disciplines and universities or training institutions to decide how to operationalise that curriculum. Instead of going back to the default mode and looking at knowledge and competency through a health professional lens, we wanted to flip that lens 180 degrees and ask people with lived experience, from your perspective, what do you think the most important things are that health professionals need to do to support you in your chronic pain care? I'd really like to say thank you to all those people who participated. We could not have done this study without that input. And we're proud of the program of work because it has that faithful level of engagement.
So just in those two short clips, I think you can see that we're working very hard to collaborate across clinicians, carers, and people with lived experience to shape our training efforts as well. And importantly, that 4-year training program will be released in mid-2024, and it's focused on very tightly on a shared interdisciplinary model of care that supports better integrated and meaningful high-quality pain care. So thank you for the opportunity to share those programs of work with you. And I hope that's been helpful in terms of sharing the work that's currently been undertaken and how we can progress this area of integrative pain care. Thank you.